blood pressure monitors, there's a number of different ways you can use it. Usually it's by putting a cuff on the forelimb, but we also we use a machine called SurgiVet, which does it on automatic timer, usually about every 2 minutes. It gives us systolic over diastolic, as well as the mean arterial pressure. The normal range for systolic is about 100 to 150. Anything over 160 is considered hypertensive or high blood pressure. The minimum mean arterial pressure that you want for an animal under anesthesia is 60. And that's a number that you get. That's the difference between the systolic and the diastolic. And you can also use the Doppler, which you actually have to shave the hair off the area, use some ultrasonic gel, and it takes a little bit longer, and you also have to use it with a sphygmomanometer, which it can take longer than just using the SurgiVet, and it only gives you the systolic blood pressure. And you can also get a blood pressure by putting a catheter directly into an artery, usually a femoral artery. And in doing so, you can hook it up to a transducer, which does give you a systolic over diastolic as well as the mean arterial pressure. But it's also more labor intensive, and it's more invasive for the animal. And there are several ways you can correct whether they have high blood pressure or low blood pressure. You want to check and make sure that it's not the machine first. Check the cuff, make sure it's the appropriate size for the animal. If the blood pressure is too low, you may have to, if the animal's on IV fluids, you can try backing up the anesthesia, and you can also increase the rate of fluids to help, and just continue to monitor the patient. If they're hypertensive, you may also have to increase the rate of anesthesia, as well as backing off the actual IV fluid rate, and check, continue to monitor the patient and see if you do see any reflective changes. But the first thing to do is check the cuff and make sure that it's not an actual